CEN Written Exams Guidelines. Question 1. A patient's blood pressure is 200/120 mmHg with headache, confusion, and nausea. The CEN should recognize this as Option A, essential hypertension. Option B, hypertensive urgency. Option C, hypertensive emergency with end organ damage. Option D, pseudohypertension. The correct answer is option C. Hypertensive emergency with end organ damage. Hypertensive emergency is defined as severely elevated blood pressure, 180/120 mmHg, with evidence of acute end organ damage, neurological symptoms, renal impairment, cardiac ischemia, or retinal changes. Hypertensive urgency has elevated BP without end organ damage. This patient's neurologic symptoms indicate end organ damage, requiring immediate 4 antihypertensive therapy, e.g., labetalol, nicardipine, with gradual BP reduction. Question 2. A patient has anaphylactic shock. The CEN should administer which medication first? Option A, diphenhydramine 50 mg 4. Option B, methylprednisolone 125 mg 4. Option C, epinephrine 0.3 to 0.5 mg IM, 1:1000. Option D, albuterol nebulizer. The correct answer is option C. Epinephrine 0.3 to 0.5 mg IM, 1:1000. Epinephrine is the first-line treatment for anaphylaxis. It causes vasoconstriction, bronchodilation, and decreased mediator release. The dose is 0.3 to 0.5 mg IM, 1:1000 concentration, in the anterolateral thigh. Antihistamines, steroids, and albuterol are adjunctive treatments and should not delay epinephrine administration. Question 3. Which of the following is an ethical principle in emergency nursing? Option A, beneficence, doing good. Option B, non-maleficence, doing no harm. Option C, autonomy, patient's right to decide. Option D, all of the above. The correct answer is option D, all of the above. The core ethical principles in emergency nursing include beneficence, doing good for the patient, non-maleficence, avoiding harm, autonomy, respecting the patient's choices, and justice, fair treatment. These principles guide nursing practice and decision-making. The CEN should respect these principles in all patient interactions. Question 4. Which imaging study is preferred for stroke evaluation within the first 24 hours? Option A, CT angiography, CTA. Option B, MRI with diffusion-weighted imaging, DWI. Option C, CT perfusion, CTP. Option D, all of the above depending on the clinical scenario. The correct answer is option D, all of the above depending on the clinical scenario. Stroke evaluation may include non-contrast CT to rule out hemorrhage, CTA to assess large vessel occlusion, CT perfusion to assess penumbra, and MRI DWI for early infarction detection. The choice depends on the clinical scenario, time since last known well, and availability. For thrombectomy candidates, CTA is essential to assess vessel patency. Question 5. A patient with subarachnoid hemorrhage presents with a sudden thunderclap headache, nuchal rigidity, and photophobia. Which diagnostic test is the initial gold standard? Option A, non-contrast CT head. Option B, lumbar puncture. Option C, MRI brain. Option D, CT angiography. The correct answer is option A, non-contrast CT head. Non-contrast CT head is the initial test for suspected subarachnoid hemorrhage, SAH. It has a sensitivity of 90 to 95% within 24 hours of onset. If the CT is negative but clinical suspicion remains high, a lumbar puncture is needed to detect xanthochromia, indicating breakdown of red blood cells in the CSF. CTA may be done to identify the source of bleeding, but CT is the initial diagnostic test. Question 6. Which finding in a patient with asthma exacerbation indicates life-threatening status asthmaticus? Option A, wheezing. Option B, silent chest. Option C, peak expiratory flow rate, PEFR, 70% predicted. Option D, cough. The correct answer is option B. Silent chest. A silent chest on auscultation in a patient with severe asthma indicates minimal air movement and impending respiratory failure. This is a life-threatening sign requiring immediate intubation and mechanical ventilation. Other indicators include confusion, exhaustion, PEFR 33% of predicted, and SpO2 90%. Question 7. A patient with bipolar disorder in a manic episode is speaking rapidly, pacing, and expressing grandiose ideas. The patient is not responding to redirection. The CEN should: Option A, put the patient in a quiet, low-stimulation room. Option B, administer haloperidol 5 mg IM. Option C, call security immediately. Option D, discharge the patient home with a referral. The correct answer is option A. Put the patient in a quiet, low-stimulation room. Patients in a manic episode benefit from a quiet, low-stimulation environment to reduce overstimulation and agitation. Redirection and verbal de-escalation should be attempted first. If the patient is a danger to self or others, medications, haloperidol, olanzapine, or restraints may be needed, but the least restrictive measures should be used initially. Discharge is not appropriate in an acute manic episode with safety concerns. Question 8. A patient with capacity has a living will that states do not intubate. The patient is in respiratory failure. The CEN should: Option A, intubate the patient. Option B, not intubate the patient. Option C, call the family to ask for permission. Option D, ask the patient's primary nurse. The correct answer is option B. Not intubate the patient. A living will, or advance directive, is a legal document that states the patient's wishes regarding life-sustaining treatment. The patient has capacity and a valid living will stating do not intubate, so the CEN should not intubate the patient. The healthcare team should respect the patient's autonomy and end-of-life wishes. The family cannot override the patient's wishes unless the patient is incapacitated. Question 9. A patient presents with a chemical splash to the eye. The CEN should: Option A, neutralize the chemical with a buffer. Option B, irrigate the eye continuously until pH is neutral. Option C, patch the eye and refer to ophthalmology. Option D, administer antibiotics. The correct answer is option B. Irrigate the eye continuously until pH is neutral. Chemical eye injuries require immediate and continuous irrigation with normal saline or lactated Ringer's solution until the pH of the eye is neutral, pH 7.0. Alkali burns are more damaging than acid burns and require extended irrigation. Irrigation should begin immediately and continue for at least 15 to 30 minutes. For severe alkali burns, it may take hours. Antibiotics and patching may be used after irrigation. Question 10. Which condition is characterized by paradoxical chest wall movement during inspiration, flail chest? Option A, pneumothorax. Option B, pulmonary contusion. Option C, multiple rib fractures with a segment floating independently. Option D, cardiac contusion. The correct answer is option C. Multiple rib fractures with a segment floating independently. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely moving segment. This segment moves paradoxically, inward during inspiration, outward during expiration, impairing ventilation. Pain control, oxygen, and possibly mechanical ventilation are mainstays of treatment. Question 11. A patient presents with acute onset of severe dyspnea, pleuritic chest pain, and tachycardia. The patient has a history of DVT. The CEN should suspect: Option A, pulmonary embolism. Option B, COPD exacerbation. Option C, spontaneous pneumothorax. Option D, asthma exacerbation. The correct answer is option A, pulmonary embolism. This presentation with risk factors, DVT history, is classic for pulmonary embolism. PE should be suspected in patients with acute dyspnea, chest pain, hypoxemia, and signs of DVT. Diagnosis is confirmed with CTA. Treatment includes anticoagulation, heparin or direct oral anticoagulants, and possibly thrombolysis for massive PE. Question 12. Which concept is part of the just culture framework in nursing? Option A, balancing accountability and safety with a non-punitive approach to errors. Option B, blaming the nurse for errors. Option C, punishing all errors. Option D, avoiding reporting errors. The correct answer is option A, balancing accountability and safety with a non-punitive approach to errors. Just culture is a framework that balances accountability and safety, promoting a non-punitive approach to reporting errors. It distinguishes between human error, at-risk behavior, and reckless behavior. The goal is to improve patient safety by encouraging reporting and learning from errors without fear of punishment. It is the foundation of a safety culture. Question 13. What is the most common presenting symptom of acute coronary syndrome, ACS, in women? Option A, crushing substernal chest pain. Option B, atypical symptoms such as shortness of breath, nausea, and fatigue. Option C, radiating pain to the left arm. Option D, syncope. The correct answer is option B, atypical symptoms such as shortness of breath, nausea, and fatigue. Women, elderly, and diabetic patients often present with atypical symptoms of ACS, including shortness of breath, nausea, vomiting, fatigue, and epigastric discomfort, rather than classic crushing chest pain. This can lead to delayed recognition and treatment. Emergency nurses must maintain a high index of suspicion for atypical presentations. Question 14. A patient with a communication barrier, e.g., non-English speaking, deaf, requires interpretation. The CEN should: Option A, use a trained medical interpreter. Option B, use a family member. Option C, use a bilingual staff member. Option D, use a phone interpreter. The correct answer is option A, use a trained medical interpreter. Effective communication is essential for patient safety and ethical care. A trained medical interpreter, in person, phone, or video, should be used to communicate with patients who have a language barrier or are deaf. Family members or friends should not be used for medical interpretation due to the potential for errors and breaches of confidentiality. Bilingual staff who are trained as interpreters are acceptable. Question 15. A patient presents with a sudden onset of sharp, pleuritic chest pain and shortness of breath, but no trauma. Lung sounds are decreased on the left side. What diagnosis should the CEN suspect? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, pericarditis. Option D, pleurisy. The correct answer is option A, spontaneous pneumothorax. Spontaneous pneumothorax occurs without trauma, often in young, tall males or patients with underlying lung disease, COPD, asthma. It presents with sudden, sharp pleuritic chest pain and dyspnea, with decreased or absent breath sounds on the affected side. Management includes observation, supplemental oxygen, or chest tube placement depending on size and symptoms. Question 16. What is the correct compression to ventilation ratio for adult CPR with an advanced airway in place? Option A, 30:2. Option B, 15:2. Option C, continuous compressions at 100-120/min with breaths every 6 seconds. Option D, continuous compressions at 80/min with breaths every 8 seconds. The correct answer is option C, continuous compressions at 100-120/min with breaths every 6 seconds. When an advanced airway, ET tube or supraglottic airway, is in place during adult CPR. Continuous chest compressions at a rate of 100 to 120 per minute are delivered without interruption for ventilations. 1 breath is given every 6 seconds, 10 breaths/min. The 30:2 ratio is for CPR without an advanced airway. Question 17. A patient with acute aortic dissection presents with a tearing chest pain radiating to the back. Which finding is most suggestive of this diagnosis? Option A, widened mediastinum on chest X-ray. Option B, blood pressure 180/110 mmHg. Option C, pulse deficit between arms. Option D, all of the above. The correct answer is option D, all of the above. Aortic dissection presents with tearing chest pain radiating to the back. Classic findings include a widened mediastinum on CXR, hypertension or hypotension if tamponade/rupture, and a pulse differential between arms, or blood pressure differential 20 mmHg. Key management includes blood pressure control, target systolic 100 to 120 mmHg, with beta blockers and emergent surgical consultation. Question 18. A patient with suspected tuberculosis should be placed on which type of precautions? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option C, airborne precautions. Tuberculosis is transmitted via airborne particles, droplet nuclei. Patients with suspected TB should be placed in an airborne infection isolation room, AIIR, with negative pressure. Staff should wear an N95 respirator or a powered air purifying respirator, PAPR. Contact and droplet precautions are for other types of infections. The patient should wear a mask during transport. Question 19. A patient with a corneal abrasion should receive which treatment? Option A, antibiotic eye drops. Option B, NSAID eye drops. Option C, cycloplegic agents. Option D, all of the above. The correct answer is option D, all of the above. Corneal abrasion, scratch on the cornea, is treated with topical antibiotics, to prevent infection, NSAIDs, for pain, and cycloplegic agents, to reduce ciliary spasm and pain. A patch may be used for comfort but is not always recommended. A slit lamp examination with fluorescein staining confirms the diagnosis and rules out a foreign body or ulceration. Question 20. A patient presents with a wound that is dirty, deep, and contaminated. The CEN should: Option A, irrigate and debride the wound. Option B, close the wound primarily. Option C, leave the wound open. Option D, apply a pressure dressing. The correct answer is option A, irrigate and debride the wound. Dirty wounds require extensive irrigation with normal saline to remove debris and bacteria. Debridement of devitalized tissue is essential to prevent infection. Primary closure may be delayed primary closure, to allow for drainage and monitoring. Pressure dressings are not the primary treatment. Tetanus prophylaxis is indicated. Question 21. A patient presents with acute pelvic pain, fever, and cervical motion tenderness. Which diagnosis is most likely? Option A, ovarian cyst. Option B, pelvic inflammatory disease, PID. Option C, endometriosis. Option D, ovarian torsion. The correct answer is option B, pelvic inflammatory disease, PID. PID is an infection of the female reproductive organs, usually caused by sexually transmitted infections, chlamydia, gonorrhea. It presents with pelvic pain, cervical motion tenderness, chandelier sign, fever, and abnormal vaginal discharge. Treatment involves antibiotics, broad spectrum. PID can lead to infertility, ectopic pregnancy, and chronic pelvic pain if untreated. Question 22. A patient with testicular pain, nausea, and vomiting has a tender, swollen testicle that is elevated. Which diagnosis is most likely? Option A, epididymitis. Option B, testicular torsion. Option C, orchitis. Option D, hydrocele. The correct answer is option B. Testicular torsion. Testicular torsion is a time-critical emergency requiring prompt surgical intervention to salvage the testicle. It presents with sudden, severe testicular pain, nausea, vomiting, and an elevated, tender testicle. Doppler ultrasound is the diagnostic test, though surgery may be indicated without imaging if suspicion is high. Torsion is a surgical emergency. The window for salvage is typically 4 to 6 hours. Question 23. A patient with a history of COPD is being discharged. The CEN should provide education on Option A, smoking cessation. Option B, use of bronchodilators. Option C, the importance of pulmonary rehab. Option D, all of the above. The correct answer is option D, all of the above. Patient education is a key part of CEN practice. COPD discharge teaching includes smoking cessation, correct use of bronchodilators, pulmonary rehabilitation, and monitoring for signs of infection. This is part of professional nursing responsibility. Question 24. A patient has a left-sided stroke. The CEN should anticipate Option A, right-sided weakness and expressive aphasia. Option B, left-sided weakness and neglect. Option C, right-sided weakness and impulsivity. Option D, left-sided weakness and aphasia. The correct answer is option A, right-sided weakness and expressive aphasia. A left-sided, dominant hemisphere stroke typically results in right-sided hemiparesis and aphasia, expressive or receptive. A right-sided stroke causes left-sided weakness and neglect, ignoring the left side of the body and environment. This knowledge helps prioritize interventions, including swallowing assessment, dysphagia, speech therapy, and fall prevention. Question 25. A patient is 32 weeks pregnant and presents with vaginal bleeding, abdominal pain, and contractions. The CEN should suspect Option A, placenta previa. Option B, abruptio placentae. Option C, ectopic pregnancy. Option D, normal labor. The correct answer is option B, abruptio placentae. Abruptio placentae, placental abruption, is the premature separation of the placenta from the uterine wall. It presents with vaginal bleeding, abdominal pain, uterine contractions, and fetal distress. Placenta previa is painless bleeding, ectopic pregnancy is early gestation, normal labor is at term. Abruption is an obstetrical emergency requiring immediate delivery. Management includes 4 fluids, blood products, and urgent delivery.